history where you came from first. So how about we touch on that? So tell me a little bit about where you've been and coming to Park Rapids, of course, for the last year at CHI St. Joseph's Health. But where's kind of been your history of your growth?
Yeah. So I went to medical school at the University of South Dakota, and then I did my residency out in Michigan. And then I did a 1-year fellowship in La Crosse, Wisconsin. And after I finished all my training, I was at the Mayo Clinic Health System in Mankato for about 12 years.
Oh, wow.
Prior to coming here.
Yep. Yeah, that's nice. Good facility there, too, in the state of Minnesota.
Yes.
From Wisconsin originally?
No, Minnesota originally.
Minnesota, okay, because I wanted to make sure if we had this cheese head thing, we had to resolve right away here quickly. Yeah, that's good. So, but tell me a little bit about your specialty, what you focus on here at CHI St. Joseph's Health, and how people, of course, we'll get to how people can connect with you, but tell us your specialty or what you focus on.
Yeah, so I'm a general surgeon. I do all kinds of general surgery, but then, my fellowship that I did was in minimally invasive and bariatric surgery. So my special focus is on weight loss surgery, and then also I do a lot of reflux surgery for people who have heartburn and things like that as well.
Yeah, and that's obvious. A lot of, pretty big window of people that use the services or look for that. Maybe changing a little bit now with the LP1s and all that stuff, right? But I'm guessing with the reflex, gas reflex, and some of that, that's pretty popular that people have that.
Yeah. Yep. It's a common problem.
And not a very big procedure to fix.
Right.
Yeah, that one's so. So let's talk a little bit about. Let's go to the obesity side of it, because if you look at all the statistics in the United States, that's a problem.
Yeah.
Pretty much so. And of course, so tell me a little bit about that focus and how you would help people in that area.
So, the obesity problem is really becoming quite an epidemic in the country, and right now about 40% of Americans are suffering from obesity, with that number expected to reach 50% by 2030. So, it really is a big problem. We define obesity from a medical standpoint by using a number called BMI, and if your BMI is over 30, then technically that's, when you have obesity. And so, there's I think the GLP-1 medications in particular have really shed a lot of light on this and have started the conversation with patients, with their doctors, and we're seeing more people, seeking treatment for this problem.
Yeah, and would you help people through that process in addition to, so it's not just the surgery side of it you're doing.
Right.
You would help people if there's an LP1 or a tri or there's another one, there's a dual one, there's a tri, then there's I can't remember, but just a little bit of reading on, really amazing. And then there's a new drug that Eli Lilly, I think, is coming out with that.
Has 3.
Yeah, it will be the third one coming on board that hasn't received FDA approval yet. But it's amazing where that's going. Now, there's things you got to watch out for, and that's your job, right?
Right.
Yeah.
So one of the things that when patients are referred to me, whether it's for medication or for surgery, the first step is to come to an information session that I give them, and that's a free information session that we do, and I lay out all of the treatment options that include the medication, surgery, and then the lifestyle modification as well, because with each different approach you can expect different amounts of weight loss, and so it's really kind of tailored to what patients are looking for.
Yeah, and we hear about a lot of people taking the LP1s, and but there's other things to watch out for. You've got deterioration of muscle, you've got the they call the stagnation of the digestive system, all of those things that you got to keep an eye on.
Yeah.
Because it's very important that you do that balanced approach, and people aren't taking too much and doing the wrong stuff. That's where you come in, right?
Yep, exactly. Yeah.
But it's been seeing really good results for a lot of people. I just look at Jelly Roll, for example.
Yeah. Yeah, and I just actually got my board certification in obesity medicine a couple of weeks ago, so that's a part of my practice that I'm starting now is, prescribing those medications, and it's a useful tool even for patients who are getting ready for surgery, or who have had surgery and have had some weight regain or things like that, or for patients who aren't interested in surgery but need a little extra boost besides just, making the lifestyle changes.
Mm-hmm. Do you see, not that the surgery side, in a lot of cases, sometimes that's the option, I'm guessing, or the best for the patient to make a choice. Do you see more and more of it, though, becoming a medicine type approach, or do you know?
I think a lot of patients are wanting to at least try that first. Surgery by far is still the best option. It's where people are going to get the most bang for their buck. They're going to lose the most weight with surgery, and it's the most sustainable. I think a lot of patients don't realize that the medications are lifelong. So if you stop them, you can anticipate that you'll regain about 2/3 of the weight that you lost.
Yeah.
And with the current cost of these medications,
They're way up there.
you know, that's a lifelong of paying that much money is definitely something to consider.
Yeah, so it's really a balancing act in figuring out what is best for the patient and what would be best. But when you're talking about approaching 50% obesity by the, that benchmark,
Yeah.
I mean, we got to get healthier as a, as a country.
Yeah, it really affects so many parts of our health, diabetes, heart disease, high blood pressure, sleep apnea. There's even now 13 cancers that are associated with obesity, and losing weight decreases your risk for those types of problems. The patients who have bariatric surgery can actually expect their life expectancy to increase by about 6 years, and that's up to 9 years if they have diabetes.
Oh, wow. So that's a considerable difference.
Yeah. And diabetes, typically, depending on how long the patient has had the diabetes and what medications they're taking, they will often leave the hospital without their medications, and their diabetes is in remission without even losing weight after surgery. And that's because of the hormones like GLP-1, which is a naturally occurring hormone. The medication is mimicking GLP-1, whereas when you have surgery, you naturally make a significant more of your natural GLP-1.
Gotcha. So, I mean, do you see that? And also, if you have a weight or obesity at a younger age, is that like going to knock on probably the diabetes side of it if you don't do something corrected?
Sure.
More than likely, you're going to end up with it, correct?
With some
That's
problem.
what you see as a trend for the most part.
Yeah, some sort of problem.
Yeah.
Whether it's diabetes or high blood pressure, there's so many different aspects that it can affect.
Or life altering.
Yeah, definitely. Women with PCOS and infertility, that's like a very common reason that women come see me, because they're trying to get pregnant and they have surgery, and then they're able to go on and have successful pregnancies. So that's fun.
That's
a really fun one.
Yeah, that's good. So tell me, what are some of the misconceptions about weight loss and weight management?
Well, there's so much stigma, and so we really try to fight that, because I think, a lot of patients are afraid to bring this problem up and talk about it. And so I think that there's a lot of people, I always hear patients say to me, like, oh, I want to try it on my own. And I try to gently correct that, because even with surgery, it's a probably 4 to 6 month process to get ready for surgery, and that's working on making some lifestyle modifications, getting more exercise. You're doing all of these things to get ready, and so I think there's a misconception that people think that they're taking the easy way out, and it's not. It's a lot of work on the patient's part. I always say I have the easy part. My part takes 2 hours. It's the patients that are doing all the work. So I think that's one thing. The old adage of eat less and move more is so wrong, and there's so many reasons, and these hormones that we're talking about are a huge part of it. We actually used to call our National Society the American Society of Bariatric Surgeons, and now we call it American Society of Metabolic and Bariatric Surgeons, because we know that what's happening in our bodies when we try to gain weight or lose weight or maintain weight is so very complex. And so really trying to break down that stigma of this is not a failure of willpower, it's a treatable medical condition.
Well, I mean, and why wouldn't we want everyone being healthier?
Yeah, exactly.
I mean, when you look at it, if there's there's no magic pill, for example. You got to change the way you do, and lifestyle changes,
Yep.
exercise, and do all that great stuff.
Yep.
That does your body well. But I mean, if there's a way to do it to make yourself healthier and a better life,
Yeah.
Why not?
Yeah.
But you got to get some help. Don't go to social media and play the game, right?
Right.
Yeah.
Yeah, that is it's concerning because you can get a lot of these medications that way, but then you're right, you don't have somebody monitoring, okay, what's happening with your muscle mass and how are your labs looking, and, because it does have an effect on those medications do have an effect on other parts of our health that need to be watched pretty closely.
So we kind of talked about the current treatment options for obesity, of course, lifestyle modification, and we talk about dietitians, lifestyle coaches, changing that, the GLP-1s, and then, of course, the actual surgery bypasses and doing some of you're pretty quick probably to understand what the patient, after meeting with them over time, what they might be possible, what they can do and can't do.
Yeah.
Yeah, I think that's probably a good screening process to say, hey, this obviously a pretty good lifestyle modification for them. I think we can do it.
Yeah, but it's really, I always tell patients we're going to follow your lead. If you want to spend a year trying to do lifestyle modification and medications, and if you're still not finding it's working for you, you're right in the right place, because then you're ready. You've been working with us. You've met all the requirements of your insurance. We can transition to surgery if needed. Other patients, they're not interested in the meds. They said, I've tried everything my whole life. I want the one thing that's going to fix me and get me better and moving on with my life. And they're want the surgery. And so we just follow their lead, really. It's kind of what the patients want, and we're there to support them as a team.
Yeah, and the surgery side, I'm guessing the extent of what you have to do depends on each individual
insurance company and patient.
And insurance, unfortunately, we
I always
have
say
to put
that
that
we
insurance
give them,
word in there. That's usually a lot of the deciding factors.
Yeah. I always say we give them stepping stones to success, and insurance companies give them hoops to jump through.
Good point. Very, very, very valid point. So, now those are some the barriers of treatment, of course. We've talked about the cost, it is, and stigma. But I think at the end of the day is, I keep coming down to the whole thing. The stigma should go away immediately when we know that we can make people healthy.
Yeah.
And if this is their choice for, living longer, and this is going to improve a lot of other things that they have going on with their health, mental health, not only just physical health, but mental health, it's important.
Yeah, it's very important. Yeah, we see that, patients a year out, their quality of life has improved so much that it's just, they can't even believe, that they ever lived another way. And so that's what's so exciting. That's the main reason I would say that people come in, is they're tired and they're not living the life they want, and their weight is holding them back. And so, just being able to support people through that and watch that change, it's really fun to see.
Yeah, and you see the person change, right?
Yeah.
That's the mental health side of it, I think, is a big component of it too. And but at the same time, they have to change their lifestyle. They have to do the right steps, and that's why you try and keep them on track.
Yep. And we keep our patients, I follow them for the rest of their lives, so we keep them close to the team, because we know it's a chronic disease. So we know that there is a chance weight can come back, whether you're doing lifestyle alone, whether you're doing medication, whether you're doing surgery. And so what's really exciting is that now there's options. It used to be like, oh, you're regaining weight, there's nothing I could do. But now we do have things that we can do to help people. And we know it's a chronic and relapsing disease, and we have to treat it that way.
Well, it's again, like you said, it has to be very rewarding when you see them getting over that hurdle and doing well and blossoming. And but at the same time, I'm guessing as they get older, things change too, and you got to keep making those adjustments, like you were just saying. So following them through life and making sure they stay on track and helping them make those choices is good. I'm guessing a lot of it's dietary too once you have that procedure.
Well, there's a lot of dietary changes that happen. I think that it's easy, down the road for things to slip back in, for that, mocha every morning or whatever. It's
the bad stuff, right?
Yeah, and that's why I think having a team to support you is so helpful, because our dietitians are just amazing at kind of teasing some of those things out that we aren't even noticing ourselves, and all of a sudden they're like, well, what's this little thing that you're having this every afternoon, that can be kind of contributing. And so that's why I think it's important to work with a team, because they're really good at kind of identifying things that we can't always even identify ourselves.
Oh, that's and not only that, but CHI, St. Joseph's Health, has I mean, the telemedicine side of it. So
Yes.
having those follow-up appointments and making sure that I love them. I mean, if you're not right there in Park Rapids or close to the facility, that's really nice to have that comprehensive care too, team approach, like you were saying. But just making sure it's right for them.
Yeah. Yep. Yep. I think that that's one thing that COVID taught us well was how to care for people that are not so physically close, and so it's really allowed our reach. You know, we can help patients much farther away, and it's not, oh my gosh, I have to take an entire day off of work to go see my doctor. You know, we can see them, and so I love telemedicine. I think it's really changed my practice in particular, and makes it much easier for patients that that aren't super close.
Well, and it also helps them when they're busy.
Yeah.
I mean, they're running, maybe in the office, they, taking this time off and getting to and from.
Yeah.
So what we're going to do is we're going to come back after the news at the top of the hour and find out how do people get scheduled an appointment with you and find out those details. And so we'll come back right after the news at the top of the hour, and then we will share that with everybody, and we'll be right back.
Great, thank you.
All right, you bet. We'll be right back. Coming up next, Fox News. And we're visiting, of course. We're visiting with, come on. Here we go. Megan Gilmore, Dr. Megan Gilmore here at CHI St. Joseph's Health. And thank you for coming in and sharing with us some of the details and being at CHI, and of course, taking care of our people here, and anyone that needs any obesity help and trying to figure that out. What's the best way, Megan, to connect with you and get an appointment and just go through that initial consultation and go through the options?
Yeah. Well, I mean, we take self-referrals, so you can just call our office. The phone number is 218-616-3800. Also, we do have the ability to put your information in online on the website, and we can give you a call back that way too if you can track down our website. But there's a if you on the CHI website, you can navigate your way through to the bariatric surgery website, and then there's ways to sign up there for those information sessions. And like I said, those information sessions are free, so if you're interested, you can just hop on and you'll learn all about the medications, not just the GLP-1s, but all of them. And then the surgeries that we provide, as well as the lifestyle support that we have.
Well, or ask your primary.
Yeah, and ask your primary,
Yeah, if you want to ask your primary for a referral, that's easy. Self-referrals you can do yourself. But if you want to work through your primary, they'll get it set up for you.
Yep.
That's what's good about it. So if you're with CHI St. Joseph's Health or anywhere, and you want to visit with Dr. Megan Gilmore at CHI St. Joseph's Health, ask for your referral from your physician.
Yep.
Yeah. So good. So any big plans? Just sticking around for the holidays?
Yeah, I'll be here. I'll be on call, so.
Yeah, so just a little on the fun side of it. Did you get a chance to take in some of the new stuff since you've been here a year, like the tree lighting and some of that?
Yeah, we
of course,
did.
CHI St. Joseph, hospice care is a very important component of that event each and every year for 39 years, but wasn't that something?
It was fun, yeah, and I had all my kids were here and my grandson for Thanksgiving, so we actually are already done celebrating Christmas. We did it the day after Thanksgiving.
Oh yeah, well, so everyone has its own, their own space because of conflicts, work and scheduling and traveling and all that. But wonderful. So welcome to Park Rapids.
Well, thank you.
Yeah, I'm glad you got to see the tree lighting because it is a heck of a great event.
Yeah, it was
great
really
event.
fun.
And then good luck to you. And don't hesitate to come in and visit again with us as you continue to blossom here at CHI St. Joseph's Health.
Yeah, thank you.
Okay, Dr. Megan Gilmore at CHI St. Joseph's Health. If you need a referral, you can do that. Self-refer. You can just go to CHI St. Joseph's Health and do that, or call them directly. Or you can ask for a referral from your primary doctor, and they'll get you all set up. So always good to catch up. We're going to be doing this routinely, too, with different departments at CHI St. Joseph's Health about monthly. So we're going to have somebody that comes in and visits with us about all the great things they're doing in health services in our communities.